Tom Nagorski. I'm the Executive Vice President here at the Asia Society, or I should say here in Brooklyn, home away from home for home away from work for me, as it has been for most of these past several months. It's great to have you with us. Today we return to a subject that we have touched on several occasions in the past few months, namely the impact of the pandemic on the Asian American community. Before we get started, as always, just a couple of program notes and a reminder that you can find out all you need to know about our global programs, upcoming programs, past programs at asiasociety.org. I just want to highlight one because it's a big one and it's coming up soon. 2 weeks from tomorrow, the 22nd of October, 8 p.m., our annual Asia Game Changer Awards, always a highlight on our calendar. It is virtual this year. It is truly global, and it's an inspiring thing we've put together, featuring, among others, Yo-Yo Ma, the great cellist, Joe and Clara Tsai, the great philanthropists, Mickey Lee, producer of, among other things, the Academy Award-winning film Parasite this year, the tennis champion Naomi Osaka, the great chef, and this year philanthropist for his native India, Vikas Khanna, and the K-pop megastars BTS, and more. That is all happening on October 22nd. For those watching in Asia, it'll be the morning of the 23rd. Again, everything you need to know about that and all our events can be found at asiasociety.org. But back to today's event. And as I said a moment ago, we've done several events on this Asia Society platform that have touched on the impact that COVID has had on the Asian American community. But today we're going to get into that issue with some greater depth, thanks to a very strong panel we have with us and a new report on this issue that is out from our friends at McKinsey. It's called COVID-19 and Advancing Asian American Recovery. Obviously, there's been great focus on the disproportionate impact of COVID-19 on the Black American community, the Latinx community, among others. But the trauma that the virus has visited on the Asian American community has been profound. It's been varied. I'll just share a couple of the report's findings to get us started here. Number one, a huge spike in unemployment in the community, more than in any other racial group. Health issues, not just from the virus itself in direct fashion, but also mental health issues that have impacted the community, and racism and xenophobia against Asian Americans, particularly in the early days of the pandemic. This quote, I just pick one here. It's one of many strong statements from the conclusions of the McKinsey report. Quote, while Asian Americans populate the front lines of health workers and businesses, generating $700 billion in annual GDP, that's Asian American owned businesses, the negative impacts of COVID-19 on this community have gone largely underreported and unnoticed. So we aim, among other things, to rectify that today and to delve more deeply into the findings, and then to get at what, if anything, can be done about them. Joining us, as I said, we have a great trio of speakers. Suba Berry is president of Working Mother Media. She's also a leader at several other organizations, including Diversity Best Practices, the leading corporate membership organization supporting diversity and inclusion, the National Association for Female Executives, and Culture at Work. Cindy Hsu, who will be a very familiar face and voice to those of you watching here in New York. Cindy is an Emmy Award-winning anchor and reporter. She's been at CBS 2 News here in New York since 1993. Recently, she was awarded Reporter of the Year from the New York and New Jersey Asian American Law Enforcement Organization. Spent a lot of time in the Asian American community doing work with them, and she served on many not-for-profit boards, including the Museum of Chinese in the Americas downtown here in Manhattan, and the Juvenile Diabetes Research Foundation. And I should say it's great to have you with us, Cindy, especially since you were called in for the 4:30 a.m. Shift at CBS this morning, so thank you. And Harrison Long joins us as well. He's a partner at McKinsey & Company, authors, of course, of this report. And I don't think I need to tell our audience, the leading global management consulting firm. He has worked previously in McKinsey's Hong Kong office. And today, Harrison Long serves clients across Asia, North America, and Europe. He's a leader of Asians at McKinsey, a diversity and inclusion group within the company, aimed at fostering and advancing of Asian Americans in the workplace. So welcome to you all, and welcome to everyone who's watching. We're going to have a conversation here and then open up to any questions you may have. Wherever you are watching and listening from today, you can post those questions using the chat functions on Facebook or YouTube. Harrison Long, let's start, if we can, with you, as you are the McKinsey representative here. We know that you and all your colleagues at McKinsey put a lot of reports out. You do a lot of work in so many areas, and they take a lot of work and a lot of time. What was the process that led you or led the company to think this was worth focusing on, this was worth the time and the energy it took to put out this report?
Thank you, Tom, for first of all, having myself and the rest of the panelists here today. I think from McKinsey's perspective, we found this to be a very important topic because as one of the key diversity and inclusion groups within McKinsey, the others being the Women's and the McKinsey Black Network, et cetera, we wanted to also have our voice heard, right? And really shine a light into this very critical topic. We also wanted to create an opportunity to consolidate many of the tidbits of stories that we've heard using a fact-based and data-driven process and share those in a comprehensive and holistic way. So that's why, through the efforts of myself and my colleagues and the support of our firm, we decided to put this report together.
So thanks for that. And what I'd like to do next really is, given your point about tidbits and stories and amplifying them, and I mentioned a few of these in the open, to more fact-based and broad-based conclusions. Maybe we could go around and not start with you because you're the most familiar with the work in the report. Cindy Hsu, let's come to you and ask, you've obviously read the report, you're familiar with its findings. As an Asian American, what surprised you or interested you most about what you read?
I would say surprised was some of the statistics that they provided. The unemployment we were talking about. We also talk about mental health statistics. And honestly, these are the types of things that I MC a lot of charities. I do a lot of public speaking. And a lot of times you want to have this information, but it isn't in one place. So there's so many things in it that are great, and I will be able to use moving forward to educate people.
Right, because you're in the world, not necessarily of tidbits, but of stories, right? And now you have a little more ballast for them. Suba Berry, was there something that jumped out at you in the McKinsey report that either was unexpected or you thought most profound or important?
Well, I really read that report at length, and I was shocked to recognize that, about a month and a half before the rest of the country seemed to feel the economic impact of the pandemic, Asian businesses had already started to lose ground. What does that say? Was there sort of a leading indicator there that we somehow missed? Was it just due to xenophobia? Why did these businesses start to lose ground starting at the end of January? Almost sort of a month and a half to 2 months before the rest of the country started to feel the impact and businesses started to feel the impact. That really sort of surprised me.
Yeah, and we will come back, obviously, to the answer to that question, if there is one, and to dive more deeply into all of these. But same question for you, Harrison, and it's a bit different because, of course, it's a McKinsey report, and you're a partner at McKinsey. But what once you got past the tidbits and the stories, what surprised you the most?
I think, Tom, even when I went into the process myself, before we wrote the article and the report, I certainly didn't really know what to expect and what to come of it. I think for me personally, there were 3 surprises that really popped up. The first is that the Asian American community is a huge part of the US economy, both from an individual perspective, about 6% of the population, 20 million people, and the businesses that they have employing a number of broader people within the US. The second is sort of the number of Asian Americans working the front lines, both medical professionals as well as people in the service and hospitality industries, In some cases, we have to celebrate because of the contribution. In some cases, we have to help because of the disproportionate impact that it's had on them. And I think the third thing is, how do we then, have a system in place and take into account that the fact that Asian American community is not a monolith. We talked about Asian Americans who are East Asians, Southeast Asians, South Asians, and even their path and their journey within America is actually very different. So how do we actually have a focused set of ideas and initiatives that can cater to as many of those people as possible?
Yeah. So thank you all, and you all hit in one way or another on the economic impact, which nobody asked me, but my biggest surprise, just as Cindy said, there are a lot of great statistics in here. They're not great; they're just interesting. But staggering to me was the figure that the community had suffered a 450% increase in unemployment from, I believe the time frame was February to June of this year. And I guess a question there is, it's really Suba's question of unemployment in the community. Why was the Asian American community sort of a leading indicator there? You've hinted at the racism question, but maybe Harrison, do you, either from your report or your own instinct, what's an answer to her question? Why that number? And by the way, as I said at the open, that statistic beats by quite a margin the impact, just in terms of straight unemployment, on any other community in the country.
No, Tom, this is certainly an interesting question. And I think one thing to start off with is there has been some talks about the K-shaped recovery that our economy is likely to experience. And I do think that the Asian American community is likely, one version of the amplified view for this, right? But to answer, I think, Subna's question, I think there's two things at play. The first is the number of Asian American businesses that we had just talked about. There's actually a vast number of them who are sort of operating in the food services, hospitality, personal care type space, which would, unfortunately, in this particular instance, disproportionately impacted, right? And I think the second thing is just to share a little bit of personal story in terms of how some of these businesses are originally, having a leading indicator. Having been previously based out of our McKinsey Hong Kong office, even in January, I had actually received some requests from family and different members of my family to actually ship them face masks. Because even at that time, even in Hong Kong, which is close to many of the factories in mainland China, they were not able to buy and procure them. So the funny thing is I actually had to buy them in New York and ship them a couple of boxes, right? So I think even for people, sort of within my line of work, within the families that I have from abroad, you actually got a sense of it very much well before the broader US society.
Right. Cindy, you're nodding. Do you want to add something to?
Well, I just want to pop in. I just did a story last week in Chinatown about, the racism and the fact that Chinatown in at least New York City was like a ghost town long before it started happening in other areas of New York. And they're trying to fight back. So honestly, I try to pitch a lot of stories down there because we have to get this out. And that's why I'm so happy about the report and the statistics. And, the media needs to get down there and get, focus on things that we haven't been focusing on.
Yeah.
So.
I mean, I'll share, and this is, I don't think, we haven't talked about this publicly at the Asia Society, but I'm not sure there's any harm in doing so now, but, and it seems like ancient history. So go back to the Lunar New Year, right? End of January, early February. And we typically have a big celebration at the Asia Society on a Saturday. And we did so this year. And at that point, there was nothing to speak of in terms of the virus in certainly not the New York area. And I'm not even sure it was present in this country, or at least not knowingly so. And we had, and we like to think we have an enlightened and sophisticated membership and clientele up at the Asia Society. I mean, we do. But there were people who quietly, of course, said, well, surely you're shutting down that event, right? And, because they just assumed that people of Asian and particularly Chinese origin would be showing up and they wouldn't feel safe there. Yeah, so back to the the economic impact here, because I think there's a couple more points to be made here. Harrison has pointed to the hard hit sectors, right? And kind of first to suffer just happened, unfortunately, to coincide with a lot of sectors that are perhaps overweighted in the Asian American community. But I assume also that that racism, while it has first and foremost a human impact and a personal, poignant one, but it clearly, or I shouldn't say clearly, did it have a knock-on effect in terms of the business community. Subha, maybe I'll ask you, because you're connected to many parts of that community.
So, that's sort of an important question to address, because you think about walking away, shying away from doing business with an Asian business owner, as an example. In my opinion, that was the early indicator. I didn't realize it, and we may not have realized it, but people were walking away, and not even if it had only been quietly through the grapevine and it was about a virus in China and we weren't really talking about it within our borders, people were already. That is systemic racism and bias deep rooted within us that scares us and makes us afraid of certain things. And then through our clients and our members in our organization, we started to hear stories even within corporations where there would be comments or innuendo. And we started to hear these stories, and we started to really work with our employee resource groups in various companies to say, what are you doing? How are you talking about it? How are you creating greater awareness around it? Because this is about, when you face an issue like this is not something that one community alone can solve for itself. Just like with the issues around racism against Black Americans, if you left it just to the Black community to solve it, it will not happen. It takes all of us coming together. And so we started really focusing on, highlighting these stories, talking about it at our conferences. And it so happens that Deb Munster, who leads diversity best practices, and myself, where I'm from, I'm an Asian Indian and she is Asian Chinese. And we really started to talk about it, not just among ourselves, but with the attendees at our conferences and so on. And I think that awareness building is one, and then being able to engage other communities to say, what can you do to be a better ally and a better supporter, is the second part of it. And that dialogue and conversation continues. And of course, now we're in a whole new phase with what has happened to Black America. Everybody has greater awareness around it, but let us be sure to learn the lessons from the ways we are trying to help solve for it. And as you can see, corporate leaders up, down, and across are up speaking about it. How can we learn the right lessons so that we translate that to be able to be deployed and used for other communities, specifically for my own community?
Right. Well, you've now started a deep dive, and thank you for it, Subha, into the whole question in this report about the racism and xenophobia. But before we leave sort of the impact, and these are intertwined, so it's no problem as we mix them up in the conversation. But before we leave the business impact, there was one nugget that I wanted to highlight in the report, because to me, again, it was a surprise, and perhaps it shouldn't have been, but I'm not Asian American, that McKinsey found that, and this is true for Asian American business owners, but also Black owned and Latino owned businesses, I quote, have little chance of obtaining a Paycheck Protection Program, PPP loan, because fewer minority owned businesses have existing relationships with a mainstream bank or credit union, a prerequisite to be approved. And then the report goes on to add the point that with the Asian American community, translation and language services, which I believe exist for Spanish, but didn't exist here. How profound, Harrison, was that? Is this an anecdotal thing, or is this beyond your tidbits and stories?
This is definitely fact-based, Tom, right? I think based on our research, about 3/4 of these small, medium-sized businesses would not be able to access these funds. And I think beyond sort of the 2 points that you have made on sort of the relationship as well as the language or the accessibility, a lot of it is some of them just didn't know that it was also available, right? Because of how it was sort of massively published, publicized, and shared within the broader community. So in some cases, these businesses actually, suffer in silence. They, sort of operate on their own and start furloughing employees quite early in the process, and unfortunately have yet still to be recovered.
Cindy, is that something you have found just in terms of the lack of either resources or knowledge about those resources in either your reporting in that community or just your work outside of journalism in that community?
Well, I kept nodding my head when Harrison was talking because, talking about kind of being silent about things. I mean, Harrison, it's kind of like an Asian thing. I hate it to be a stereotype, but it's not about, hey, we need help. And then with the whole model minority, banner put on everybody, everyone thinks, well, they're Asian, so they're doing okay. In fact, the gentleman who was a community activist in Chinatown that I interviewed the other day, he said that a lot of people think that Asian immigrants just come with luggage full of money. And that's just not the way it is. And the reason it's important is because, as you said, they don't get the services. Because some groups would say, well, why do you care that you're called the model minority? That would be a good thing. But it's not a good thing because it's not accurate.
Right.
Well, we recognize, Tom, something else that was interesting. Many years ago, when I built the Multicultural Business Development Unit at Merrill, we did a lot of business with South Asian hotel and motel owners. I think that there's a disproportionate amount of ownership of these mid-sized, smaller hotels, motels within the community. And the way they actually finance themselves isn't through banks. They usually lend, one family member comes, sets up one, and then, as they make money, they buy another one, invite other family members to come in and join to help run it. So they lend to each other. But when you have a pandemic like this, everyone's business is down, and you no longer have the same lifelines that you used to have with the banks that you assume an organization would have with banks. Because if that is not the traditional way you financed your business, it's not something that you start during a pandemic.
Right. Suba, I want to come back to something you got at in your earlier answer, and now to take that slightly deeper dive into the whole question of racism directed against the community. With just a quick note again about Asia Society programming. We had an interesting, you talked about sort of before the George Floyd murder and after. We had a big event on this platform, I believe it was in the first week of May, that brought a whole lot of voices together under a heading, Standing Against Racism. But at the time, it was very much given who we are and our audience and our community. It was about the racism you were talking about a moment ago, targeting, I guess in particular, the East Asian community, the Chinese American community, given what the president and others have been calling the China virus and all this sort of thing. And it was interesting because you mentioned the Black American community, and there were representatives of that community who joined us on the platform to say, we stand with you, et cetera, et cetera. And now, it was June, I believe, that George Floyd was murdered. We wound up having another iteration of that event, which I'm speaking very simplistically here. It was much more than this, but where now Asian Americans were joining to stand up with the Black American community. It's a long way of saying, what have you found, any of you, maybe we go down the line, just, I know we want to talk about facts and really core, research done by McKinsey, but when you talk about experiences, this kind of thing, you do have to come back right to personal stories and what one hears. Maybe we can just take with each of you. Cindy, I'll start with you because, whether it's experiences you have had or experiences the subjects of your stories have had, what have been the most profound things in terms of COVID and what it may have led to in terms of racism against the community?
Well, the Chinatown in Lower Manhattan, what I found incredible and also painful is that the community activists actually started a group to patrol the area to really protect the vulnerable, the seniors and the children from being attacked in any way because they had experienced that. So, I just think it's really important for us to do these stories and so people know that it's happening. The other thing is I've had a lot of friends who have been pushed or spit on or, go back to your country after COVID came, or you make me sick, that sort of thing. So when I was on the subway the other day and, we all have masks on and everything, I honestly did feel, I saw a woman looking at me and I thought, oh my gosh, is she going to say something because I'm Asian? And then I honestly saw another passenger who was an Asian male. And I thought, I hope nobody does anything to him either. So
just to follow up on that a little bit, do you think that the fact that the virus now exists everywhere, right? I mean, all of us know that viruses don't have nationalities and ethnicities and all of that. But now, even those who don't understand that or choose not to understand it, they must see and know that actually, sadly, we are living in the country that has one of the highest both mortality rates and incident rates. Do you think that, was it worse in that period where it seemed to be only prevalent in, not only in China, but really only in Wuhan? I mean, I guess my question, Cindy, is, do you think that has gotten better in any way? That may be a hard one to answer.
You mean as far as in where I live, New York City, as far as bias attacks on Asians?
Yeah, I mean,
earlier.
Given that it is, even if you are xenophobic, it's and there's not a logic, right, when you think that way. But the logic would, of course, say this virus exists everywhere, and actually it exists here far more. So if you're even illogically going to be scared of people, you ought to be scared about, about everybody in your community.
I don't think it's getting better. I think it's getting worse. I think, as we discussed, the language people are using to China plague, all these different things that is not stopping, that just fires everybody up.
Yeah. Harrison, did you have, apart from the report itself, either firsthand, secondhand, or none at all experience of this kind of hideous behavior?
Yeah, I think, at least on my side, Tom, the most profound story was one of the ones that we had shared in the report. But I do want to take a moment to elaborate a little bit more, because I think this actually builds on top, and probably even more so than what Cindy had just shared, right? We had interviewed a Chinese American doctor based in New York. So in addition to having some not so nice words said to him during the subway commute after long 15, 18-hour shifts, there has also been instances where in the hospital, doctors and nurses, where certain patients actually question, it's like, do I actually want you to be my doctor or nurse just because of your ethnicities? And these are actually the moments where these people are trying to help you, and things like that. Conversations such as those taking place, it's actually very troubling. And actually, not very good to be having at that particular point in time.
And just back to my question about you and your personal experience, have you had any, or have you?
Well, to share, we do have a family business in Chinatown, and to see it all boarded up and closed for many months is definitely telling, right? And has also affected myself personally to a certain degree, definitely.
Suba, you said something to me when we were discussing before this event. I don't want to put words in your mouth, but basically you felt as a person of South Asian ancestry, almost that it inoculated you, I think, a little bit against some of the more virulent stuff. But speak to that or any other point you'd like to make on that.
So you look at my appearance, and obviously, I'm not East Asian, so to some extent, I have not faced that sort of virulence. But it's not just the xenophobia; it's the anti-immigrant mindset. Somehow, as though you're going to come in here and you're taking, resources away and a place that belonged to someone else. That has been on the rise. And so these incidents of xenophobia and the impact of that had been rising, and then it almost seemed like this virus gave them an added incentive to target it very specifically to one community. I have a friend's nephew who was who faced a bias incident, and believe it or not, that was in the Bay Area. And one would think where there's a preponderance of a population that you would perhaps have better understanding, but that is not the case.
Right.
And I believe that, can you think about what it feels like to know that this is how your community is perceived? Think about the mental toll that it takes. The virus has taken a mental toll on all different constituencies. Women, for example, specifically working parents, have really been challenged. But you overlay on that this xenophobia and the additional pressures, and then you overlay on that a community that really is not that great about acknowledging this notion of internalizing that sort of stress and bias into you, and not being able to ask for help, not being able to speak out about it. And I really believe that we will have a mental health pandemic that follows this pandemic if it isn't already in place.
I certainly, I hope you're wrong. We're going to get to that issue in a little greater depth. You're very good, Subha. You're better than I am about reminding me where we want to go next in the conversation. But I'm reminded also, as you were speaking, I mentioned we've done other events that have come to this subject. And we had a gentleman who's a physician in New Jersey. I don't remember the hospital nor his name. It doesn't matter. But he was South Asian. And he spoke. And here we have, I said these things are intertwined, right? But an intertwining, if you will, of the health issues and the racism, where on more than one occasion, he was sort of, there was a COVID patient coming in. It was a war zone, a war room, pick your metaphor. And it was pretty clear that the patient just didn't want anything, didn't want him handling the case. And, but let's come to the health questions. And before we get to mental health, which is highlighted in the report, am I right, Harrison, that in terms of actual incidence of the coronavirus, whereas there, the Black community, the Latinx community has been disproportionately hit, that the Asian American community, not so. Is that correct? Just in terms of actual COVID cases?
Yeah, so I think there's actually a quite certain amount of COVID cases as well. Now, it really depends on where the individual's living and whatnot, right? Because if you look at the Asian American community, most of them actually live in the coastal areas, larger cities, metropolitans, which has a higher population, right? The second thing is what you also need to think about some of the Asian community is that they live in more high densely populated areas, right? Mm-hmm. If you frequent down, Chinatown, Brooklyn, 8th Avenue, et cetera. These are multi-family dwellings, multi-generational dwellings, also in some cases that, would also increase, potential infection rates, right? Particularly from the physical health perspective.
Got it. So let's pivot then to mental health, because this, back to the initial question of what surprised you or jumped out, and perhaps it shouldn't, but here's a statistic. 19% of white Americans in this period, as Subha said, of great mental anguish for people all over the country, 19%, so roughly 1 in 5, have sought help for mental health issues. 5% of Asian Americans. Now, here, I guess, one ought not to assume that small a percentage of Asian Americans are suffering the issue. I take it that the conclusion is they are not seeking the help they need. I don't know who wants to jump in on that.
Well, I know they're not seeking the help they need. 5 years ago, I experienced a mental health crisis for the very first time in my life, and suffered from depression, a very severe depression that led to a suicide attempt and also psychiatric hospital care. And I couldn't talk about it for years. I just pretty much recently have been talking about it because I understand how important it is to try to break down that stigma that is in the Asian community, many communities, but so much in the Asian community of we're not talking about it. In fact, I met some patients whose parents knew about it, but they wouldn't let them see a therapist because that's weak. They wouldn't tell the family what really is going on. My family didn't even say it for a while. So now I've kind of taken a total flip, and we need to speak out about it. I think Asians in particular really don't get the help they need, but I will say there's lots of help out there. And once you start talking about it, you say, oh my gosh, this person, you're shocked because you find everybody has some sort of connection, whether it's a family member or themselves. And it's a disease, just like anything else, like a physical disease. So there should be no shame in seeking help for mental health.
Well, Cindy, thank you for speaking about that because it takes courage to come out and be public about it. And in the Asian community, it is really seen as a weakness. You have to somehow figure out how to get over it. It's all in your mind. What they don't understand is that it can be as much of an illness in your mind as it is a physical illness. I have a brother who suffers from deep depression, and part of it is, as a man, he's expected to even more so man up and not exhibit it. People don't talk about it. And I think all of that continues to compound the stress on the individual, and they don't receive the support. Forget about, medical support, even the love and support of immediate family members. If you have to camouflage and mute and cover that part of you, how difficult is it to wake up every morning and go about your life?
And Tom, what we have also been able to see as part of the research is that 1/3 of Americans have reported witnessing individuals blame Asian Americans for the outbreak, right? And reports of anti-Asian violence and assaults has been on the rise, and therefore increasing some of the likelihood of these mental health issues. Also, about 39-40% of increase in mental health support texts and reach outs from Asian Americans, according to the crisis text helpline in the first quarter of 2020. So we actually do see a rise in some of these situations, and therefore we actually suspect that demand is actually even higher, but the people are just not getting the help.
So first of all, let me echo what Subha said. Cindy, you're generous and good to share that experience of your own. And Subha, same to you vis-a-vis your brother's experience. And here we have, right, a marriage of facts and figures and statistics, which Harrison and the McKinsey report have provided, and two very profound personal stories. And I was going to wait a moment before turning to what can be done about all this, but this is such a profound thing, and I don't know that no knock on McKinsey, but I don't know that a McKinsey report can address it. So, but let me ask, starting with you, Cindy, because your story is so deeply moving. What do you think it's hard to reverse a deeply held cultural, if that's what it is, feeling, stigma, that sense of weakness. What might be an effort that might help to turn the tide on that?
I think it takes people talking about it and sharing their story without shame or judgment. Also, some of the mental health resources, they need to be in Asian languages, because in addition to not wanting to seek help, sometimes they're not able to because it's not in their language. Also, I was talking to a friend the other day, and I was telling her about what we're doing today and telling her about this amazing report. She's one of my best friends and one of the most intelligent people I know. There were so many things in here that she was really surprised by. So I feel like we need to have conversations with people who don't know anything about this, because so often it's the people who do know about it who reading the report.
Yeah. Subha, any thoughts from you on that front? What can be done to at least push back or alleviate the stigma a bit?
I have to tell you that sometimes we tend, as a community, we tend to be self-effacing. We really don't want to draw attention on ourselves. But I think each one of us needs to think about this as drawing attention on someone else from our community. If we are embarrassed about it, drawing attention on ourselves, let us pretend, I'm going to pretend this is for my brother or for Cindy or for Harrison that I'm doing this. We need to call out the numbers. We need to have these things in our head. We are smart. We can cogently put together a story around it that says, you know, don't miss out on understanding the pain that we are experiencing. And I have to confess to you that when you really look after the George Floyd murders and others in that community, there's obviously a lot of corporate focus and attention on the Black community and working to say, what can we do to fix it? And I get it. It is the Black house that is on fire now. We need to put out that fire. But I will also say to you that we need to again think about, how is it that we have instigated action on the part of our corporations and our corporate leaders to not just speak out with words, but actually show in their actions what they can do, promoting, Black women and men, putting them onto boards, supporting organizations within the community. And I believe that we need to learn how to advocate for the Asian community in a similar way, because in some ways, we're just kicking the can down the road. And I'm going to say to you that unless we start to address it in some way today, now, down the road, we're going to swap one set of issues for another set of issues and problems.
Very well said. There are questions coming in, and a couple of them, Harrison, go to you because they're about some technical things about the report. Number one, are the findings based on data collected in major cities only, or is the data reflected of the experience of Asian Americans in suburbs across America? Where was the, if we can say, where were the questions asked?
Yeah, so our data that we have retrieved was actually nationwide. We looked at the Bureau of Labor Statistics and other governmental agencies, as well as leveraging other some reports that has been out there. So it is sort of nationwide across different cities, right? And we try to paint as comprehensive of a picture as possible for the entire community.
And then a second question, which goes to now what with the report? Has the report been shared with local and national government officials to help address some of the issues unveiled in the report? Asks a viewer on Facebook. I assume McKinsey is doing more than just talking to the Asia Society audience about this, right?
First of all, this is a very important session. So we're happy, very glad to be on. But I think this is right? I think just linking to some of the points that has been raised already, we're working with various bodies, right? Nonprofit organizations, in some cases, lobby type organization, political groups, etc., to see what they can be done, as well as business groups, right? Because I think the idea here is how do we, not just write a report, but actually do something about it and affect change. Yeah. One thing that we really want to push for is having the ability to understand the data, because before you can, cut and dice how you wish, in some cases the data is not even, collected or tracked at a granular level that can distill some of these programs that we had just talked about. And I think the second thing is, really combating this bias and xenophobia, whether it's pre-COVID, post-COVID, during COVID. Just systemic racism and injustice has no place in this country, no matter what community you're part of and the timing of it, right? And I think we should also, form different resources group within companies so that people can talk about it, as well as workplace training for the broader community. And I think the third thing is, because the Asian community is such an economically powerful one, because of the big cohort and the businesses that they run, it is also important for business leaders to, cater to this community, whether it's with certain products and services, for some of the programs that we had talked about, because I think as part of the broader recovery and the reimagination of the country, it is very important that Asian Americans be a core part of that as well.
Yeah. Well, I'm glad you mentioned the recovery, because after all, that word I think is in the report title, and so this takes us from the problems that the community has experienced and then gets to, okay, what can be done about it? Suba Barry, you're so connected to so many of these professional organizations. What's essential in terms of helping these communities, particularly, I think by recovery, I take that to mean economic recovery primarily, but to help them start to build back. And so those communities that Cindy sees all boarded up and when she's going and reporting her stories or just walking in Chinatown, I mean, that's just the tip of the iceberg. But what needs to happen for that recovery to go as smoothly as possible?
Well, I think you need to, begin with figuring out how do you reduce racism and the scapegoating and the stigma that has been attached to it. And I think to do that, you have to be able to sort of communicate clearly about what is fact and what is not. You have to raise awareness around it, and you have to help people have the courage to be able to speak up against it, which may be, Asians themselves advocating for themselves and for their community, but also rallying colleagues across all other community, including white colleagues that can step up to say, hey, why would you say that? I think that we need to create the combination of that allyship and courage. Allyship alone, the empathy, sympathy, that is not just enough. You need to have courage that accompanies it, that allows people to stand up and be heard, to support what's incorrect, to say, stop that behavior. And sometimes, I use the example of, you have a crying baby in an airport. Sometimes it takes somebody other than the parent to say, hey, what's going on? And all of a sudden this child stops. So I would say to you, it is powerful to get somebody that may be my white colleague or my Black or Hispanic colleague that steps up to say, why would you say that? That's really terrible. And all of a sudden it will, sort of halt behavior. So that's really sort of the first step. The second one is then to really begin to understand, for those people that need mental health support, et cetera, making sure that they have access to it. Employee resource groups within organizations can really play a big role in being that voice within, because they have a connection within their own organizations and can really be able to speak about this effectively. But we need to arm them with the data. And that is why this McKinsey report is so valuable, because it allows people to lead with facts and data, as opposed to this is how I think, I feel, I believe. Right. All of those are great, but you need to tie that with facts. And then, some sort of social contract, how do you within organizations, you can do the same within the community, how do you really bubble up these concerns? Is it the one and done? Or do we look at it 6 months or a year from now and revisit with it to say, is it any different? Are attitudes any different? Or does that behavior, continue to be the same? Like when Cindy said, the incidence of bias haven't gone down. They've actually been at the same rate or even increased, in spite of the fact that now the virus is among all of us. Mm-hmm. So I believe that those are sort of great starting points. And in my mind, I worry about what will happen when people start to return to work. Will those people that have either had COVID, will they face a different kind of bias? Mm-hmm. I think that the impact on women, especially multicultural women, and in this case, I would talk about Asian women. What is the impact on working women? The latest numbers on that are alarming. I think you probably saw in the New York Times and in the in Fortune, the data around the number of women that are out of work now that are not likely to go back anytime soon. And disproportionately, women of color are burdened by that. Yeah. So those are all the sorts of things that I would really make sure that corporations, which are in many ways taking a lead on this, I would really, hope that leaders would step up the way they did for the Black community, that they would find a way to have a similar voice for the Asian community.
Well said. We have time for just a few more questions. We're still getting some more online. And Cindy, you're going to get on the hot seat here. Not really the hot seat, but I can remember in my many years in journalism, and if I was ever on a panel, I'd always get this question. So here it comes. It doesn't say from whom, but for Cindy, why isn't the media reporting more on this? And I don't know what this means in particular. It could be anything we've been talking about.
I'm guessing they're talking about things that we are learning in this report, things that people don't know about. I think very much is something that we've discussed, how the Asian community does need to come together more and be louder, because very often that's how you pressure places to do stories on your community. So that's something. Yeah,
I put you on the spot, but I guess.
No, Cindy, I have a question for you.
Sure.
What if allyship took a different approach within the various subsets of the Asian community? If I am uncomfortable advocating for myself, South Asians, what if I advocated for East Asian, my East Asian sisters? Would that be a different voice if I were to be able to speak about their issues and vice versa? Is that another way to create some kind of bonding and allyship within the community that allows us to come together and not just be, I think it was Indra Nui who said, this is 5 fingers. You can't do much with 1 finger by itself, but together it's a fist. And I would love to think of how we could perhaps advocate for each other within the community across the subsets.
I agree. It would be very strong if we advocate for each other. Just like it's strong when we see a lot of the marches and it's so many communities coming together, it makes it stronger if it's not directly affecting the person who's out there.
And I would only add, and we can get out of the journalism part of this conversation, that, having been an editor, but I've never been an editor at CBS 2, so I don't know, but the stories you both told about just on the mental health side of your own personal and family experiences, I can imagine, even just the two of you talking about that, and the point that you both made in one way, shape, or form about how, when others in the community hear what you've gone through, and they say, oh my gosh, that's kind of what I'm doing, I might have a profound effect and might be a good story. But I didn't mean to answer the question that Cindy was asked. Two quick ones, one from me and one from the audience. The one from me is just back to a problem that I'm not sure there's a solution in the report, and I just wonder whether there can be a solution at all. And maybe Harrison, I should ask you this. The whole issue of, you point out, and the report points out, that Asian Americans are overrepresented in these businesses that got so hard hit. It's one of the things you said at the beginning of this conversation. Now, let's say, God forbid, we have 3-4 years from now, some new health crisis, something that seems to be a deja vu in terms of the problem. What's to prevent the same scenario from playing out? I mean, you can't suddenly reorder the Asian American presence in certain sectors of the economy with a snap of your fingers.
No, I think, Tom, that's a very good question. I think the key thing here is to, beyond understanding the data, is to actually devise a set of programs that can cater to these businesses. As what you said, I don't think the split of the type of businesses that Asian Americans own is going to change overnight, or even in the next X number of years, just because they are what they are for a reason. So I think the idea here is, how do we help these businesses for them to be as successful as possible given the current pandemic, whether it's be certain access to PPP loans,
right,
or even differently designed programs that tailor to this community.
Got it. Good answer. Maybe more hopeful. The last question, and it does come from an audience member, and I almost hate to go here, but because it's politics, would a Biden victory change things in your view in terms of the xenophobia question, in terms of the public? Who wants to take a stab at that one?
I will take the first stab, Tom, because I'm going to say to you, you left the genie out of the bottle. It's going to take a while for that genie to go back. I was one of those people, the day President Obama was elected, I was in Hong Kong. I was speaking at a conference. It may have been an Asia Society conference, actually. But anyway, I was so excited. I felt like we had broken that amazing glass ceiling, that things were going to be different in the United States. And I have to tell you that I always believed that there were 10 to 15% of the people who are perhaps xenophobic and who are racist, but the bulk of the people are, either ambivalent or supporters. And what has the last 4 years taught us? That there is deep-seated resentment against anybody that may not be white. And if that is the case, then it's going to take us a while to put this genie back in the bottle and maybe completely drive it away. So I would say to you, I'm mixed on how quickly we will resolve it just because the administration changes.
Any dissenting opinions?
I think the only thing, Tom, Cindy, Suba, that I'd like to add is, regardless of whichever administration or whoever's president, right, red or blue, I think we still have a long way to go for the community. So I think regardless of the political landscape and the spectrum that we operate in, we should still devise certain programs and certain services that is tailored to this community. Because as I mentioned, the community is an important one within the economy. So we just need to make sure that they're well taken care of.
Yeah, well said, well said. We need to wrap it there. This has been a great hour, or just short of an hour. And before I thank our guests, I just want to remind folks it's the new report from McKinsey, what we have been talking about here. It's called, quote, COVID-19 and Advancing Asian American Recovery. You can access it at our website, asiasociety.org. My thanks to Suba Barry, Harrison Lung, and Cindy Hsu. Really appreciate all your insights and your comments. And those of you who may have missed the beginning of this conversation, will be up on our site with everything else within a few hours or tomorrow. From all of us at the Asia Society, we thank you, wherever you may be watching. Stay safe, and we'll see you next time. Thank you.